University of Utah health doctors are discussing how misinformation has led people to refuse COVID-19 vaccines, reject public health measures, and use unproven treatments. ABC4's Haley Hendricks was at that panel today. She's joining us now live in Salt Lake City with more on what they have to say. Haley?
Emily, the nation's trust in public health has significantly gone down during the COVID-19 pandemic, and University of Utah healthcare doctors say they're seeing this happen all too often. Research from the National Institutes of Health shows misinformation and fake news during the COVID-19 pandemic has generated confusion and insecurity for people.
Misinformation contributes to our distress as a country and as a society quite a bit. When we are suspicious of each other, when we don't trust each other, it's hard to form healthy relationships, and that's what we really need right now.
A national poll conducted earlier this year shows the level of trust isn't just a problem for federal health agencies, but local and state health departments too. At the University of Utah Health, doctors say they're feeling this heightened level of mistrust.
There's so much information coming so fast, people don't know what to believe, and so they're turning to sources that may not be reliable to get that information.
Posts that elicit a strong response, fear, anger, sadness, those are more likely to be amplified through their algorithms than other types of information.
And they want people to know they can turn to their physicians as a reliable source, but to also recognize that experts are still learning about COVID-19.
This is our understanding right now based on the information that we've been able to gather to date. But things may change once we learn more.
With so much new and changing information constantly coming out about the coronavirus, Dr. Kristen Francis says it's taking a toll on people's mental health.
We also are hearing stories of just everyday people being who have never had an underlying health condition starting to suffer from some of that fatigue and developing an anxiety condition around all the information that's changing.
Doctors say misinformation isn't always spread intentionally, but that's why it's important to think critically and check the information for credibility and supporting evidence. Now, just last week, the U.S. Surgeon General said the spread of misinformation is a serious threat to public health. He's encouraging each of us to not share information we're not sure is true. Reporting live in Salt Lake City, Haley Hendricks, ABC4 News.
Thank you, Haley. Well, a warning tonight